You are in the bathroom about to flush, and for a second you pause. Your poo looks looser than usual. There's a trace of blood on the paper. Or you have been going more often for weeks and quietly blaming stress, aging, or something you ate. Most bowel changes are not cancer, which is important to remember. But bowel cancer can sometimes start with ordinary changes that feel too small, too embarrassing, or too easy to explain away. You will learn 7 signs that deserve attention after 45, when they may be less serious, when not to wait, and the quiet warning that may not show in the toilet at all. UK medical guidance recognizes that bowel symptoms can have many causes, and a symptom on its own is not a diagnosis. The useful question is not whether every stomach upset is dangerous, but whether a change is new, persistent, unexplained, or unusual for you. That distinction matters because many people know their partner's routine, their parents' habits, or their own normal better than any chart ever could. Short-term bowel changes are common. A different diet, dehydration, more alcohol than usual, antibiotics, iron tablets, painkillers containing codeine, stress, travel, a stomach bug, piles, or irritable bowel syndrome can all change how often you go or what your poo looks like. These causes are often less serious, especially when symptoms settle quickly and there are no other warning signs. The mistake is assuming that every new bowel change after midlife must be harmless, simply because you can think of a possible explanation. The first sign to take seriously is a lasting change in bowel habit. Some people normally go several times a day, while others go only a few times a week. What matters is a shift from your usual pattern. You may be going more often, having looser poo or diarrhea, becoming constipated when you usually are not, or noticing that your bowel routine has become unpredictable. 1 or 2 off days are usually not the concern. A change lasting around 3 weeks or more, especially after 45, is worth discussing with a GP. The second sign is blood in your poo or bleeding from the bottom. Bright red blood on toilet paper is often caused by piles or a small tear, particularly after straining, but it should not be automatically dismissed if it is new, repeated, or mixed with other symptoms. Blood can appear on the paper, in the toilet water, on the surface of the poo, or mixed into it. It may also look darker. Visible blood does not prove bowel cancer, but repeated bleeding is not something to manage in silence, because embarrassment feels easier than making the appointment. That embarrassment is one of the biggest reasons people wait. Many adults feel awkward describing bowel symptoms, especially if they have always been private about their health. But GPs hear these concerns every day, and you do not need polished medical language. Saying, "I have noticed blood when I wipe," or "My bowel habit has changed and it has not gone back to normal," is clear enough. Seeking advice early is not wasting a doctor's time. It is giving them the chance to decide whether simple treatment, a test, or further checks are needed. The third sign is ongoing tummy pain, cramping, or bloating. Occasional wind, bloating after a large meal, or mild discomfort after constipation is very common. The warning is pain or bloating that keeps returning, feels new for you, or appears alongside changes in poo, appetite, or bleeding. Some people describe a dull ache low in the tummy, while others feel unusually full after eating less than normal. Pain alone can come from many conditions, including constipation, diverticular disease, gallbladder problems, indigestion, or infection, but pain that travels with bowel changes deserves a closer look. The fourth sign is a feeling that your bowel has not fully emptied. You may go to the toilet but still feel pressure, urgency, or the need to go again soon afterwards. This can happen with constipation, piles, inflammation, or irritation in the lower bowel, so it is not automatically sinister. But if it is new, persistent, or paired with bleeding or a change in frequency, it should be mentioned. Some people also worry when their poo looks thinner than before. Narrow poo on its own is not a reliable sign of cancer, but a lasting change in how bowel movements feel should not be ignored. The fifth sign is unexplained weight loss or a reduced appetite. This one can be confusing because many people in their 50s, 60s, and beyond are trying to lose weight, eat less, or become more active. Intentional weight loss is different. The concern is when weight drops without trying, clothes become looser without a clear reason, or food suddenly becomes less appealing. Cancer is only one possible explanation. Thyroid problems, diabetes, depression, long-term infection, and other digestive conditions can also affect weight and appetite. The point is not to assume the worst, it is to find the cause. Risk factors help complete the picture, although they never give a definite answer on their own. Bowel cancer becomes more common with age. Risk can also be higher if you have a close family history of bowel cancer, previous bowel polyps, long-term inflammatory bowel disease such as Crohn's disease or ulcerative colitis, or certain inherited bowel conditions. Smoking, heavy alcohol use, carrying excess weight, being inactive, and eating a lot of processed meat are also linked with higher risk. None of this means cancer is inevitable, and having no obvious risk factors does not make symptoms impossible, which is why changes still matter. The sixth sign is the quiet one promised at the beginning: unusual tiredness, weakness, breathlessness, dizziness, or looking paler than normal. This may not appear in the toilet at all. Bowel cancer can sometimes cause slow bleeding inside the bowel, and the blood loss may be too small to see. Over time, this can lead to iron deficiency anemia, which means the blood is less able to carry oxygen around the body. People often blame it on poor sleep, stress, age, or being busy. But if normal tasks suddenly feel harder, especially with bowel changes, ask for medical advice. This is also where a common misunderstanding can cause delay. A symptom improving for a few days does not always mean the issue has completely gone, because bowel symptoms and bleeding can come and go. Another misconception is thinking a screening test replaces seeing a GP. NHS bowel cancer screening is important and should be completed when you are invited, even if you feel well. But if you already have symptoms, do not wait for a screening invitation, and do not ignore ongoing symptoms because a previous test was normal. If you speak to your GP, the next steps are usually practical rather than dramatic. They may ask how long the symptoms have been happening, whether there is blood, whether your weight or appetite has changed, and whether bowel cancer runs in the family. They may examine your tummy, arrange blood tests to check for anemia, or offer a FIT test, which looks for tiny amounts of blood in a poo sample. Some people are referred for a colonoscopy, where a thin, flexible camera checks inside the bowel. These tests can feel worrying, but they are routine and can also find non-cancer causes that are treatable. The seventh sign is urgent because it may suggest a blockage or significant bleeding. Severe or worsening tummy pain, a swollen abdomen, repeated vomiting, and being unable to pass poo or wind need urgent medical attention. Heavy bleeding from the bottom, black sticky poo with feeling faint or very unwell, collapse or severe sudden abdominal pain should not wait for a routine appointment. If symptoms are severe or you feel seriously unwell, call 999. If you are unsure what to do and it is not immediately life-threatening, NHS 111 can guide you. For non-emergency concerns, contact your GP if a bowel change lasts around 3 weeks or more, if bleeding is new or repeated, if weight loss is unexplained, if appetite changes without a clear reason, or if tiredness and breathlessness feel unusual for you. If getting an appointment is difficult, keep a short note of dates, symptoms, stool changes, bleeding, weight changes, and any medicines you take. Clear information can make the consultation more useful and help the receptionist or clinician understand why you need timely advice. This information is general and cannot replace a personalized examination, diagnosis, or advice from a qualified healthcare professional. The central lesson is calm but important. Most bowel changes are not bowel cancer, but persistent, unexplained, or unusual changes deserve attention rather than embarrassment, guesswork, or waiting for them to become impossible to ignore. If you feel comfortable, share what helped you get a bowel symptom checked, or subscribe for calm, evidence-based health guidance. Look before you flush. Notice what is different for you, and act early enough to give yourself the best chance of a clear answer.